today. And I really appreciate all of you being here today. This is a really wonderful day that was made possible by some very generous donors. Certainly I want to recognize those donors as we start today. We had 4 main donors donating this project to the tune of $500,000. And if you're here, somebody, a representative from any of these foundations, if you'd stand up and wave so we can just give you a quick cheer. Ron and Jen Klimisch, $500,000. Thank you, Ron. We have the B.A. and Esther Greenhack Foundation, Brian and Pam. We have the Judd S. Alexander Foundation. Gary, you still here? And then we had another anonymous donor. So those were our $500,000 donors who collectively raised the $2 million towards our $3 million goal. In addition to that, we had $200,000, the Dwight and Linda Davis Foundation. Is Jeff here? Okay, no. And the Greenhack Fan, who donated products. So round of applause for those 2 donors. At $100,000, we had Ron Scheubert and Judy Stratting. Are they here? Thank you both. We had Aspirus at $100,000. Eric's here on behalf of Aspirus. The North Central Health Foundation, who is chaired by Don Grotti. I saw Don's back over in the corner there. Don. And then Steve and Pam Anderson. Did I see, is Steve here?
He is.
Okay, there he is. Hey, Steve. All right, just a couple more that I want to recognize. $50,000, we had the River Valley Bank Foundation. Anybody from River Valley here? No? Marshfield Clinic Health System. And then the Walter Alexander Foundation. A round of applause for those $50,000 there. And then I've got 4 more at $25,000. We have the Community Foundation. Gene, I see you there. Thank you, Gene. There from the beginning. The Marathon County Medical Society. Anybody from the Medical Society here? Fred and Beth Miller. And then Camille and Todd Nicholas. So those are our major donors. But what was most impressive about this campaign were the 600 other donors that gave whatever they could to make this happen. There's been a strong group behind this project from the beginning, the Warm Water Works group. And at this point, it's their voices that I think matter the most because it's a great day for us to be able to be here to celebrate the future of your pool in this community for the next 30 days, or 30 years. Tommy. All right. So with that, I would like to introduce our first speaker, a man who brought the aquatic therapy pool to North Central Healthcare in Marathon County in 1970s and was our first and longest serving CEO, Mr. Peter DeSantis.
Boy, is this ever appropriate. Right. Thank you, Mike. As I look over this group, I have to think back 40 years when Dorothy Farrell and I had a vision of a swimming pool to serve our clients, and in time, hopefully, the nursing home residents. And then we wanted to reach out to help meet the special needs of the residents of Marathon County. And through the efforts of the volunteers and staff, you've done an outstanding job in meeting that goal that we set. As I look forward to what you are breaking ground today, I can see 40 more years of service to the residents of Marathon County. So I personally want to thank the volunteers for all their effort, the medical community, the staff, the board, and the county board for all your efforts in bringing this to fruition. Thank you, and God bless you.
Okay, next, thank you, Peter. Next we will have representatives of our Warm Water Works group come to the podium to say a few words. So Brenda, Marianne, and I believe Steve are going to come up.
Well, I cannot believe that we are here today. Finally, huh? I just want to take a minute to thank the staff for staying and working through this process with us. Over the years, we've heard a lot of stories about the work that they do and how they're a positive influence on the community. So, thank you for coming to work every day and doing what you do. Years ago, I asked the pool patrons to help me develop a advisory committee to help us with the process. They later named themselves the Warm Water Works. This group has really stepped up to the plate. I heard them over and over again ask, what can we do? What can we do to make a difference? What can we do to help? The more that they got told no, the harder they worked until they got the word yes. So this day is for them. Thank you. Physicians who stepped up and was on an advisory committee. They put the why into the community of why we needed this warm water pool. So thank them. Also thank you to the Marathon County Board for finally giving us the okay and partnering with the community. I think that that's a pretty neat thing to see them partner with our community. So Also, thank you to the community for stepping up and giving so generously to get this pool built. When we weren't sure if this pool was going to make it, we just kept pushing. So thank them for all the time that they had to endure, the phone calls and all of the letters, but we're here. I would like to thank Steve Anderson. He kind of fell in our lap. He was an angel. He knew a lot of people in the community. He knew who would want to help with this project. So, thank you, Steve.
Good afternoon, ladies and gentlemen. Good news for you folks is that Michael covered part of my comments, so we'll move through quickly. This is a good day for Marathon County. It's a good day for our donors and volunteers who spent a lot of time and generously donated their money. It's an especially good day for current and future pool clients who are in pain, are in need of rehab, would lose or lack some mobility because they're unavailable to the pool, have diminished quality of life, and perhaps even a decreased lifespan without the warm water therapeutic pool. And so we're very happy that that has been accomplished. That we have the money and we're going to put the shovel on the ground today. I think Brenda touched on this. I've done a lot of fundraising over the years, and this is one of the most pleasant processes when you finally get together so many cross sections of the community in a partnership. And everybody from government to donors to users, this was really a significant event, and I think there's a lot of communities would be envious of us as to how this process came about. Finally, I would like to say, volunteers, there's a lot of them in this process. There's been a lot of them involved over the years. their only reward is personal satisfaction that there's something good that comes of the community. A good deed is accomplished. These are priceless members of our community. You should thank them wherever you see them. They don't look for recognition very often, but this good deed has come to fruition. Again, it's a great day for the people of Marathon County. Thank you.
Well, it's never a dull moment, that's for sure. I promise you when we do the dedication, when this thing opens, we'll be indoors. Okay? So plan for that. And we can truly see the commitment in this room to this project and want to be part of this day. So with that, I will turn it back over to Steve so he can finish his comments, and we'll finish the program in here.
Thanks, Michael. I just wanted the opportunity to introduce Mary Ann Dykes. Part of my comments were to talk about the Warm Water Works Group. I joined them about halfway through the process as a 1 or 2 time meeting, give us some insight on fundraising. And when all said and done, it was pretty hard to leave the group because there was enthusiasm. Anyways, as I look back at this, there were 3 components of really drove this whole thing for how many years? 11? 11? Okay. Vision, faith, and determination. And the vision was somebody that understands the history and can see into the future and say, what do we need 10, 15, 25 years down the road? Those folks have. Faith, that people would come together through the proper education and training, and communication, etc., and really see how this could value the community. The third item was determination. And there were times when I was, a lot of these Warm Water Works meetings was, sometimes you could see that, you could understand that failure might have been kind of hanging there. You never knew which way the winds were going to flow politically, etc. But I never saw defeat. And that is not more exemplified than Mary Ann Dykes. She led this group for 11 years, determined that this was going to happen, and took the minutes, sent out the invitations for the meeting, organized people to do their particular functions, and I would just say, please give her a big round of applause for her comments.
I stand here today with a heart filled with gratitude for the commitment of each of you to bringing this project forward. From the beginning, we've been a grassroots group, talking in the shower room about what we could do to save the pool. We have been determined to educate, document, and justify the positive impact of this facility on the quality of life and well-being for all of those who use it. We have been persistent in our efforts, and with the support of Steve Anderson, John Robinson, and Michael Loy, whose guidance and skills have been phenomenal, this day has arrived. Brenda Budnick and the pool staff have continued their quality services under multiple challenging times. Thank you to all of you. So my thanks to all of you in this room for helping with mailings, contacts, bake sales, brat fries, pizza sales, and you all know all of the rest. Each one of you are a part of the team, and we have and will continue to support this pool into the future. Warm water does work.
All right, thank you both. With that, I'd like to introduce our County Board Chair, Mr. Kirk Gibbs.
Thank you, Michael. Good afternoon, everyone. I prepared a short 20-minute speech for you all. Never give the microphone to a politician. You know. The one thing that sets Marathon County apart is when we commit to working together toward the goals of being the healthiest, safest, and most prosperous. What we can accomplish. Great things. Marathon County has outstanding leaders willing to work towards these goals. People like Peter DeSantis, people like Michael Lloyd, people like Brenda Budnick, Steve Anderson, Mary Ann Dykes, just to name a few. this new warm water therapy pool would not be a reality without their leadership. This collaboration between community and government is a fine example of what can be accomplished when we work together. The vision of being the healthiest is not just words. It's a commitment to making a difference in people's lives, improving the quality of life, and in some cases, allowing for their independence. The Marathon County Board, along with the North Central Healthcare and the community, have worked together to provide the needed resources in continuing the warm water therapy pool as a tool in achieving this goal. On behalf of the Marathon County Board of Supervisors, I want to thank all the donors for their generosity. Without their support, the new pool would not be a reality. Today, we're taking an important step in continuing the warm water therapy program and making a difference in people's lives. I know everyone here today is looking forward to, with great anticipation, to the grand opening. We also can't lose sight of the fact that today's groundbreaking for the therapy pool is also symbolic, is a symbolic first step in the Marathon County's $73 million commitment and investment in this campus, revitalizing the nursing home and the mental health and substance abuse facilities. Now, let's move forward with a new chapter in Marathon County's history. On just a little bit of a side note, I don't know that I've been on the Marathon County Board now going on 14 years. There hasn't been one issue that has been brought up before the board that's had more discussion and more meetings than the warm water therapy pool. So we're moving forward, and thank you for everything. Thank you.